And good evening, everyone. Y'all know his name. We are here today, live from Atlanta, West Primary Care. I am Dr. MJ Collier, your host and on-air personality, coming to you live tonight for our pre-Valentine Day show tonight. We are here this evening to talk to you about getting ready for Valentine's Day. We have so many great products that are available to you, but what we want you to do, ladies and men, we want you to get the Go Red for Valentine's Day package. That is the Lipo T for the men, taking 2 or 3 capsules every day. The Lipo Hers for the ladies, taking 2 capsules every day to enhance your sexual function. What do these products do? For the men, enhances your erectile function, increases your testosterone, makes you feel good, act better, have longer, harder erections, and last longer and ready for round 2. Ladies, makes your vagina thick, makes your vagina wet, increases your libido, makes you more receptive for the sexual act. So it is good to have both products in your home because you don't want one partner hypersexualized and the other one not quite ready for the boost and the requirements now to meet and satisfy the needs of the person that's been stimulated by a product like Lipo T or Lipo Hers. So get those products today. Go to the website lipodrops.com and you too can find out how to go red for Valentine's Day. So I had the privilege of attending a function this week at the Morehouse School of Medicine here in Atlanta. That function is called Men's Heart Healthy Breakfast. And at that time, we were talking about cardiovascular disease, again, the number one killer of people around the world, disproportionately represented by African Americans. African American men have a 300% higher rate of dying from a heart attack or a stroke than Caucasian men or men of basically any other color. African American females also at high risk as well for cardiovascular disease because oftentimes the symptoms do not manifest themselves in the same way in a woman. They may think that she's having a panic attack because it's oftentimes when you're having chest pain and you're feeling short of breath, you become anxious and you have anxiety. So oftentimes women are misdiagnosed as anxiety. They're treated for anxiety/panic. They're not even evaluated for cardiovascular disease. They're discharged from the emergency room, go home and die. This happens more than we like to discuss in the healthcare community. Women in particular have been underdiagnosed and undertreated. Once again, African American women and African American men disproportionately representing this disease state. So at this forum, and I was the guest of Miss Scarlett Presley Brown and Mr. Wendell H. Brown. I was the guest at their table that was, I think, being sponsored on the road by CHOA, Children's Healthcare of Atlanta. So they were there. I was their guest at one of the tables. I had an opportunity to spend quality time with the president of the Morehouse School of Medicine, Dr. Valerie Montgomery Rice, a highly esteemed OBGYN who is one of the few female presidents, and I think the only African American female president of a medical school here in the United States. So a lot of distinguished guests there, but the main thing was the barbershop style discussion that was being held about cardiovascular disease. And so that was what was incredible about it. You got medical information, but it was more infotainment, which is kind of what Dr. Collier specializes in. If you have been following this program, you know that we did a barbershop style presentation during the Black Nurses Conference here in the city of Atlanta. We had a barber chair, a patient in the barber chair that received a haircut, but during that time we discussed everything from prostate health to cardiovascular health, preventing heart attacks and strokes, diabetes, etc. Just basically went down the line. So that is a very good forum, and we like to say that the barber shop and the beauty shop are amazing opportunities to not just discuss politics, but to discuss health. So whenever you and your family members are gathered together, or you're with a group of friends, you may be playing cards, spades, tongue, bid whist, or it may be a social function celebrating somebody's birthday. If you're sitting around the table, have the health discussion as well. You need to find out about your personal health when you're at a family gathering, like Thanksgiving, or just over the families for dinner. All the family members getting together, the brothers and the sisters, etc. You need to find out what are the disease states that are prevalent in our family history. Is it high blood pressure? Is it diabetes? What type of cancer did grandmama have? What type of cancer did Uncle T die from? Those sorts of things you need to know specifically. Because when I ask patients, I say, tell me your family history. Are your parents both still with us? Are they alive? No. What did your father die from? And at what age? I don't know. I think he had cancer. What type? I don't know. It was everywhere when he died. So you want a little more specific information so that you can more efficiently and effectively articulate what your family history is, so that you and your provider, your doctor, can partner to optimize your health, to lead you in the right direction as to what type of disease states to screen for, or what type of cancers you should be monitored for, what type of disease states. Are you predisposed to high blood pressure? Are you predisposed to diabetes? All of those things. So that was a great, phenomenal event over at the Morehouse School of Medicine, where it was hosted by the Morehouse School of Medicine. It was actually at the Atlanta or Georgia Aquarium in downtown Atlanta, the Georgia Aquarium. And so today, that was Monday. On today, the uh, the First Lady of the United States of America, Dr. Jill Biden, she spoke at a women's luncheon on women's health. And so that was also underwritten. So it was a multi-day event hosted by the Morehouse School of Medicine, the local, supported by the local links chapters, and again, other organizations in the community like the Atlanta Medical Association, the Georgia State Medical Association. There were people that were attending locally, and there were people that were from all over the country that were attending this event. So thank you so much for your time and attention. Heilig, let's do our roll call and see who's in and tuned in tonight. Okay, Sean, Big Time Green. Good evening, Sean. So glad to see you and so glad to hear from you. Edwina Reddick, good evening. Thank you for being here, Edwana. Okay. Chris Goodjohn, good evening from Greenville, South Carolina. Chris, once again. Mimi Witcher, all the way from Tampa by way of Atlanta. Good evening, Mimi. Lola Peoples, good evening. So glad to have you here as well. All right, CL Turner from Baton Rouge. Okay, CL, I want you to send me some seafood and some Tupperware. D. Johnson from Pembroke Pines, Florida. Got to get down to Florida where the weather is nicer. Siobhan LeConte or LeCount, Linda Jackson. Okay, Linda Jackson. Hey, how you doing? So glad to have you here. Deborah Mathis from Denton, Texas. Thank you, Deborah, for joining us this evening. So glad to have you. Carolyn Brown, Michigan is in the house. We're so glad that Michigan is here. We love Michigan. Sherry Gamble, good evening. We are glad to see some of our regulars here, but we have people from Canada. We have people from Africa. We have people from Carolina. Glenda Everett from Warner Robins. Thank you so much for joining us this evening. Charlotte Morrison, twin, hello. How are you? Thank you for joining us. Sharon's Barclay, good evening, Sharon. We appreciate you for being here. Sharani, I think it's Sharani. Travis Thorne from Columbus, Georgia. Travis, thank you for being in the house with the Your Health is Important Ask Dr. MJ radio program. Jackie May, good evening from Beham, Alabama. Okay. Lynette Stevens, good evening from Baltimore, Maryland. Thank you so much for being here as well. Okay, and so today's Rickey Smiley Morning Show was preempted, the Your Health is Important radio broadcast, because we were honoring the passing of the son of Rickey Smiley, Brandon Smiley, who tragically passed away from a drug overdose. Today was his birthday, and so today was an opportunity to remember him, listen to some things, because he was a budding comedian as well, and just some of the things that he did and said and showed that he did have a great life that ended far too soon. So rest in peace, Brandon Smiley. We are glad that we had an opportunity to participate in that event today. So let's get to your questions. It's your show. Whatever your healthcare questions are, we'll try to get to them right now. Dr. MJ Collier, your medical ready reference. TJ, what medications or supplements are good for stronger erections for diabetics? Okay, diabetes, because it attacks blood cells and your vasculature on a cellular level. The mechanism of erection is one of blood flow. And when you have diabetes, that blood flow is interrupted because capillaries cannot fill with blood as effectively and efficiently as they need to give you longer, harder erections. So your traditional medications like Viagra, Levitra, and Cialis, do work well. I do believe that the Levitra is a better product, works better in diabetics. Those are taken when you're about to have intercourse. So within an hour, no less than 30 minutes before having sex. But you can take them. The effect lasts 6 to 8 hours. So you can take any of those, say 5 o'clock in the evening, because one of the biggest problems is that the most common behavior before having sex is going out to dinner. So you go out to dinner, you have a few cocktails, you're back home now, it's 8:30, 9 o'clock, you take the pill, and nothing happens because it's negatively impacted by food and alcohol. So if you take it, say at 5 o'clock on the way home from work, it'll be there till after midnight. So that way you're going to have good response to it. But if you don't want to be controlled by that time limiting factor, the products that we have on our website, the Lipo T for men, the Lipo Hers for ladies, these are products that you take every day. They give you a baseline level of sexual physical fitness so that you're always ready, and it enhances your love life traditionally. So I would say people that have diabetes in particular, you want to continue and enhance the undertone of your sexual function. So just taking it kind of when you need it is not going to give you that level of physical fitness. It's just like when you go to the gym. You go to the gym, you work out, you get stronger, you get harder. Well, for a male, you take the Lipo T, you're going to be ready because you're going to get stronger, you're going to get harder. You take a medication like the Viagra, Levitra, or Cialis, they will give you benefit, but they won't improve your sexual function overall. And so that they will allow you to get through that episode. So sometimes I have patients that do both. They'll take the Lipo T every day and then still take a Viagra or a Cialis or a Levitra, uh, 30 minutes to an hour before they are scheduled to have sex for an even greater response. So all those things are things that you can do. TJ, you can go to the website right now, lipodrops.com, where we got a Valentine's Day special going on. Get ready for Valentine's Day. You can get some great deals on the Lipo Drops, on the Lipo T and the Lipo Hers on the Lipo Drops website. Thank you, TJ. Great question. Winnie King. Hi, Winnie. How are you? Dr. Collier, is Nexletol 180 milligrams too high of a dose for elderly people? No, on the contrary, Nexletol is a medication that's used to lower your cholesterol. It is, I guess you can say, easier on the liver. It works better with the liver. It doesn't cause increased liver enzymes, nor does it cause as much myalgia or muscle problems in people who cannot tolerate traditional statins. So 180 milligrams is not too high a dose. It's a standard dose, and it doesn't matter really what your age is that's required for you to take the medication. So 180 milligrams is the fixed dose of Nexletol. It is a great product. And again, a lot of people who cannot tolerate your traditional statins like Lipitor, atorvastatin, Crestor, rosuvastatin, and Zocor, simvastatin. These are your big three statin class drugs that are very important to lower your cholesterol and help prevent its primary prevention for a heart attack or a stroke, and secondary prevention of a recurrence if you've already had one, usually at higher doses. But Nexletol was invented for people who have difficulty tolerating those medications, which is a very small percentage of the population. But if it's one out of a million and it happens to you, it's 100%. So we want to make sure that is a great option, Winnie. That is not too high a dose. From 9 to 99, that is the dose that's appropriate to lower that cholesterol. Great question. Okay, Lynn F. Are fat removal procedures offered through Sonobello effective for belly fat? I have lower belly fat that I want gone. I've lost about 50 pounds with that flap of fat on my lower belly. The Sonobello is a great new technology that does permanently remove fat without surgery. It does it by basically focusing under the skin. So on the skin surface, there's no heat, there's no problem, there's no damage done, but the focus is done under the skin and it destroys the fat cells. So it is very good for that type of problem that you have. That's called a platus. And it can, some people say Dunlop, where your stomach is, you got a flap that Dunlopped over your belly, and it can hang over your private parts and it can be unattractive. Now, there are other procedures too. Strawberry laser liposuction is very good for that as well. Sometimes none of those things, depending upon if it's just due to a 50-pound weight loss, aging, and childbirth, then the Sonobella may be effective for giving you that, for removing that, or definitely will make it look better. Sometimes you have to surgically, basically just cut it off and then sew the skin back together, and you have a low level scar that's kind of like, it's called a cesarean section, that scar in that area just above the pubic bone. So instead of going up and down and giving you a scar down the middle of your stomach, you get that area, a fanny steel insertion there that will give you a scar that's acceptable to remove that. So all those are options. You need to have that. Make sure that your expectations are clearly understood and that they explain to you what the Sonobella can really offer you, and to see if it's going to be worth the money. It is an expensive procedure. It is still less expensive and definitely less invasive than surgery. There's no real recovery time. You get the procedure and you get results very, very quickly. After a few sessions, you get a great result after the very first session. But it's going to require multiple sessions, and then you'll get the best appearance after the first session, and then the maintenance sessions just kind of to maintain it. And you can, if it starts to come back or later, you could go back 6 months to a year later and redo it for maintenance purposes. So that is a new technology that is working very well and being well received because, again, it doesn't require any preparation. There's no downtime, and it works wonderfully. But it is not a panacea. You need to make sure that what you want and what it is offering you are matched up so you won't be disappointed by the results. Okay, Lynn, great question. William Cardwell, oh my goodness. I went to the ear doctor and I have to have surgery because my right ear always has fluid. The doctor said my adenoid is large. Is there anything I can do about that besides surgery? Well, William, I'm presuming that you have done the basic stuff, which is take and use a nasal spray like Flonase or Nasacort, a decongestant like Mucinex, and a non-sedating antihistamine like Xyzal, Zyrtec, Loratadine, Claritin, or Allegra. That combination of three things and nasal saline douches of your sinuses, because the problem with the ear is that the plumbing that goes through your ear down through the middle of your throat, it connects with the back of your throat, and sometimes it becomes obstructed. The purpose of that plumbing is to drain fluid from the middle ear. The purpose of that fluid in the middle ear is to lubricate the three bones in the ear that you learned about in the 6th grade. Those bones are the incus, the malleus, and the stapes, the hammer, the anvil, and the stirrup. They vibrate continuously, which is the mechanism for hearing. But because they're vibrating next to each other, they can literally wear themselves down if it's not lubricated, just like a car engine needs oil. So that fluid provides a lubricant for those bones to effectively and efficiently vibrate without damaging themselves. And once that fluid is used up, it drains down the throat, and the lining of the middle ear makes more of that fluid continuously. If it's not draining appropriately, that fluid will build up, and it is literally starts to make your eardrum bulge, which limits your hearing initially, and then can also cause a lot of pain and discomfort. So treatment options include tympanostomy tubes, where they put a tube in your ear so that the fluid drains this way instead of down the back of your throat. That compromises you in several ways. As an adult, you can't go swimming because you can't get fluid and you can't get water in the ear. And you have to be careful even when you take a shower. That tube will usually stay in place for months and months, and then it spontaneously comes out. It's supposed to do that, after which you have had normal fluid flow and it might not ever recur, or you might have to keep getting tubes put in. If the problem is caused by large adenoids, which are blocking the outlet of the eustachian tube where the fluid is draining from, then you get the tonsils and the adenoid removed, and that will fix the problem. So those are the surgical options. Those are simple surgeries. I used to use the term minor surgeries, but a patient brought to my attention said, Dr. Collier, there's no such entity as minor surgery when you're the person that's being operated on. And I agree with that wholeheartedly. So not minor surgery, but not debilitating. You can go in the morning, be home by lunchtime, eating ice cream in the afternoon, and back to work in just a day or so with minimal downtime. And that will fix the problem, hopefully permanently. And so, routinely, when I was growing up, everybody got their tonsils taken out. I got mine taken out about age 5. And I just don't have the problems that I'm seeing in a lot of adults now who did not have their tonsils removed in childhood, and now it's coming back to haunt them. So those are your options, William. Great question. We appreciate you tuning in. Edwana Reddick, I'm still having hot flashes with my hormone patch. Okay, Edwana, you need bioidentical hormone replacement therapy, but there is a new prescription medication called Velusia, Velusia, that is made specifically to fight hot flashes. And you start taking it today, your hot flashes are improved. Tomorrow, after you've been on it for a couple of weeks, your hot flashes should be decreased totally and possibly even totally relieved. But again, that is treating the symptom and not treating the problem. That acts centrally in the brain and blocks the receptors from the hormones that make your body have the hot flashes. But if you get bioidentical hormone replacement therapy, that will correct the problem and give you many more benefits. You will lose weight. You will decrease your body fat. You will increase your muscle mass. Your attitude will improve. So it makes you feel better about yourself. You look much younger. You feel much longer. It makes your vagina thick. It makes your vagina tight. It makes your vagina wet. And it drives your libido through the roof. It is literally the freaking fountain of youth. So bioidentical hormone replacement therapy, BHRT, a procedure that's not covered by insurance. It's a boutique procedure. It is one that Dr. Collier performs in his office, and it's a multi-stage thing. You have to have some special blood work drawn. Once you get the results of that blood work, which evaluates your neural hormonal status, the results of those tests are placed into a computer algorithm that designs a bioidentical hormone replacement therapy that is unique to you. So the traditional hormone patches and the pills like Premin and progesterone are fixed doses. Everybody gets the same dose. Everybody takes the same number. And so it's nothing unique. It's not customized to you. But with bioidentical hormone replacement therapy, everybody gets a different dose. I have put the dosing is with what's called a pellet. The pellet being about the size of a grain of rice. Now, I have put as few as one pellet in some people. I have put as many as 14 pellets. So it depends on what you need, but it uniquely fixes what's wrong with you and corrects it. And it gives you back what your body stops making or makes less of by the time you're in your 30s. It stops making by the time you're in your late 40s or 50s. So it literally is the fountain of youth. So this is something you can Google. You can look up B as in boy, H happy, R retro, T Thomas, BHRT, and BHRT providers near me. If you're in and around the city of Atlanta area, give me a call. We'd be happy to discuss it with you further. Now, also go to the website lipodrops.com. Our LipoHERS product is great for addressing perimenopausal and menopausal symptoms. That is one of the great benefits about taking that product on a daily basis. It gives you the benefit of relieving you of a lot of those hormone symptoms. So that would be a much less expensive way of determining how you feel and how much better you can feel by replacing those things that your body is no longer manufacturing. So go to lipodrops.com, look at the LipoHERS. That might be just the product that you need. You can try that. You can take that in addition to the bioidentical hormone replacement. You can take that in addition to your hormone patch and see if that combination of the LipoHERS and your hormone patch gives you the symptomatic relief that you're seeking. Great question, Edwana. Thank you so much for being here tonight. A freckled soul has been dealing with severe digestive issues. Recently had a scope done and discovered medium ulcer, medium hiatal hernia, and acid reflux. I throw up at least once a day. Okay, a freckled soul, you are challenged. Now, you have gastroesophageal reflux and possibly chronic esophagitis, irritation of the lower portion of the esophagus that's been basically digested by excess acid in your stomach. So you should have been tested for a bacterial infection called H. pylori, which we found out is the major cause of people having ulcers. We thought it was the excess acid. The acid itself is not the problem. The problem is this bacteria that literally eats the lining of the stomach. It was thought that no living organism could tolerate the acid environment of a person's stomach, and so that wasn't a real issue until it was. And we found out using electron microscopy that these bacteria not only live in there, they thrive in that excess acid environment. So there's a course of treatment that used to take 3 months that's now down to 4 to 6 weeks, where you take two different types of antibiotics, amoxicillin and clarithromycin, and you take what's called an H2 acid blocker, a proton pump inhibitor, like Nexium, Protonics, those types of products, and then you do that, and then that clears up that infection and allows your ulcer to heal. And then you may stay on an acid blocker for some extended period of time to control those symptoms. Sometimes it has to be dilated because if you're vomiting, that means you have slow gastric emptying, and that could be due to a condition called gastroparesis, where the stomach squeezes in three different directions, helping you digest food. But at the bottom of the stomach is an opening where the food should move out of the stomach and into the small intestines. When that does not happen in a rapid enough fashion, then food has to go one way or the other. If it's not going down, it comes back up, and that's what makes you vomit. So vomiting is not good for your esophagus because your stomach has a mucus lining that protects it from the acid environment, so the stomach can't and won't digest itself. It's nothing basically but a piece of meat, just like a steak. But as soon as you're out of the stomach and you're into the lower portion of the esophagus, there is no mucus protection. So the esophagus can be digested and perforated, means it gets a hole in it, and you're getting that acid going inside your chest, and it can insult your lungs, it can insult the lower abdomen intestines, it can digest your internal organs just like you digest a chitlin. So it is important that that is controlled. Once if that acid comes up and you're throwing up, it is having a negative impact on the mouth and the oral health. Your teeth are being dissolved by that acid. So it's an entire capitulation of things that can happen as a result of this. You're going to have a great partnership with your primary care doctor, with your gastroenterologist, to help control these symptoms and treat them in an appropriate manner. You also actually need to get your dentist involved to optimize your dental health as well, because once you start losing teeth, your health status changes. And if you have teeth that are not damaged or minimally damaged and can be restored, that should be an active part of this process as well. Hey, Freckle Soul, we want you to do better. Stick with us. Let us know how you're doing. Get back with us and give us an update on your status, okay? Ira Bell, 53-year-old black male diagnosed with Parkinson's disease 3 years ago. My doctor said I'll be a good candidate for DBS. Can you give me your opinion of that particular surgery? Couldn't find info. Well, they have surgeries now where they basically block that portion of the brain. They have several things they can do. They have a patch-like device that they can put on the surface of the brain and stimulate the brain and control the Parkinson's symptoms, which are basically shaking. Parkinson's disease gives you what's called a pill rolling. So your hands move like this, and your head can move like this, and it just basically gives you the shakes because your nerves are constantly stimulating, and it makes your muscles move. So there are new techniques that can give you, again, they can install those electrodes in the brain to control that. They can take out a portion of it that's causing an excess stimulation, and the brain tissue will adapt, and you will not have any deficits because the brain's got a lot of excess. You're not using but a small portion of the brain, and so the other parts of the brain that remain intact can learn and adapt and re-educate various parts of your body as to what to work and how to work, etc. But this is a process. Parkinson's disease is just incredible as to how I'm seeing it more frequently. It's occurring more frequently in the population. I don't know whether it's because people are living longer. That's part of it. And so they're capturing, but it's happening in younger people. So it's not necessarily the length of life that is happening in. I have young people. I have a teacher. I have a fireman. I have a truck driver. Truck driver's career was totally devastated. He had new onset Parkinson's within 6 months. He is totally and completely unable to drive, and that changed him from a six-figure lifestyle status to basically now being on disability. So it was life changing. So Aaron, again, continue to do your research. Don't just look for that on the internet. Do your own, be your own advocate, and look for basically new and enhanced therapies for Parkinson's disease that are available now because there are new products that are available. Great question. MS Dorsey, what is good sexual enhancement drug to increase sexual desire for a couple? Oh boy, you asked the right question, and we got just the answer for you. For supplements that you don't need a prescription to get, again, a Lipo T for men and Lipo Hers for the ladies. The Lipo T, again, contains multiple things that increase your testosterone levels, increase your libido, increase your sex drive, increase the quality and nature of a man's erection, makes erections longer and harder. Now, for a woman, stimulates the vagina, makes the vagina wet. Oftentimes, if a woman is not stimulated, or even if she is, she becomes less capable or even incapable of becoming wet enough, cannot lubricate her vagina, so that the act of being penetrated is very uncomfortable and unpleasant. So unless you use a lubricant like KY jelly or even saliva is a great solution. It's always there. You can use that. But things you don't use Vaseline in the vagina. You don't use any oil-based lubricants that can do that. So you want aqueous or water-based lubricants. They have Astrogel is amazing. It works wonderfully as well. They have some type of sexual lubricants that get warm. At the store where everything used to be $1 and now it's $1.25, they have a sexual lubricant that you can buy and try for $1.25. And because it also causes warmth, a warm sensation, that should enhance and increase sexual desire in a woman as well as a man. So all the things that we talked about, and then for men, there are the prescription medications, Cialis, Levitra, and Viagra. There are no pills or other prescription medications for women that exist. Believe me, they are trying to come up with something that is the equivalent to the male Viagra for a woman. They have tried a couple of things that really have not worked well. And so again, a product like our Lipo Hers is the magic bullet for this. So get ready for Valentine. We got great deals going on Lipo Hers now. Try that. Remember this though, it is not a one pill and things change the next day. You have to take it every day and you have to be on it every day. People ask me, well, how quickly does it work? Every day is better than the previous day. So every day you will be better. But after you've been on it for a few weeks, you will be markedly improved and you'll be able to definitely tell the difference. And by the time you finish the first month's supply, you will be a changed person and you will want to stay on this medication, because once you become Superman or Supergirl, you don't want to become Clark Kent again. You do not want to go back to being Clark Kent. So MS Dorsey, great question. Okay, Yolanda Hampton, I just started Lipo Drops a couple of days ago. Do they decrease your appetite? Yes, they do. They decrease your appetite, but more importantly, the primary mechanism of action is it alters the way that your body metabolizes food, but it does decrease your appetite. That's one of the benefits of the Lipo Drops. So you're not as hungry. And now, so you have to embrace that, because you can eat around it. And people say, I wasn't hungry, but I ate anyway because I was used to doing that. But this is a great opportunity, because you've noticed a decrease in appetite, to decrease your portions. And once you feel full, stop eating. Stop eating, because Dr. Collier has cut, for those who've been following me, you know that I've had a 30-pound weight loss in the last 6 months or so, utilizing all things Lipo products, but predominantly the Lipo Drops Maximum Strength Formula, which you can use 1 dropper full under your tongue before each meal, breakfast, lunch, and dinner. And now we have the Lipo Nights product, which makes you burn fat. It has fat burners, but it also has melatonin so that you can sleep well. And when you get a good night's sleep, your body does not manufacture or make that stress hormone cortisol. Cortisol causes increased abdominal fat. It gives you that belly that you're trying to avoid having or you're trying to get rid of. So the Lipo Nights product is very good as well. Now, when I had my weight loss journey, the Lipo Nights product did not exist. So now that combination of the Lipo Drops Maximum Strength and the Lipo Nights will give you optimal weight loss. I'm looking at your profile picture there, Yolanda. It don't look like you have a lot to lose, but if you do, again, the weight loss that you can expect from the Lipo Drops Maximum Strength formula is approximately 10 pounds per month. The average weight loss diet, the strip mall diets like Quick Weight Loss, Jenny Craig, Weight Watchers, I'm Too Fat, I'm Too Big, all of them are basically based on calorie restriction. And guess what? They all work. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight virtually 100% of the time. The problem is when you stop doing it, you will usually regain that weight and sometimes exceed the amount of weight that you lost, which is the biggest problem with losing weight by calorie restrictions. So the objective is not to restrict your calories with the lipo line. The lipo drops maximum strength, changes your metabolism, and changes the way your body addresses food. So it stops you from storing food as fat. Once that's been happening for a few weeks, your body recognizes this as, I don't need to store food as fat. So now, instead of, at first it stops storing the fat, then it says, I can release the food that I have stored as fat because I don't need it. So you will lose weight from places you cannot traditionally exercise it away from, like under your chin, like the back of your arms, the inner and outer thighs. And of course, our tagline is lose the muffin top with lipo drops. So you will lose your abdominal fat. So these are great opportunities to do that. So you can use the lipo drops once, twice, or 3 times. So breakfast and dinner, breakfast, lunch, and dinner. And the more you lose it, the greater your weight loss. So great idea. Go to the Lipo Drops website, look at the pinpoint diet plan that goes along with the Lipo Drop product, and look at maybe considering adding the Lipo Nights as well. And then get back with us next month and let us know how successful you have been. We don't want to know about it in a couple of weeks. I tell people that are on a weight loss program, don't weigh yourself every day because you'll be disappointed because your weight can fluctuate on a daily basis. But every week you should have a substantial and significant weight loss. So pick a day that's going to be your weigh-in day. Weigh either wearing the same outfit or try to weigh butt naked in the morning after you've emptied your bowel and bladder. That way, and using the same space on the floor for your scale, because just simple changes in your floor space can give you changes in your scale readings as well. So important. That way you'll be consistent and you'll be able to document. So it doesn't matter whether my scale says you weigh 140 and your scale says you weigh 135. The difference is both of our scales should measure a change in your weight. So if my scale says you weigh 145 and now you're down to 135, then that is a true and confirmed 10-pound weight loss based on my scale. And people always tell me, they say, Dr. Collier, your scale is wrong. My scale at home, and I always say, well, it's probably because when you're at home, you're weighing naked or lightly dressed. When you're at the office, you got on clothes. And so clothes can add 3 to 5 pounds to your measurement when you're standing on the scale. So that's why we ask you to do that. So be consistent. So Yolanda, Ms. Hampton, thank you so very much. We appreciate your follow-up. Okay. Ms. Lacinia Hall, talk about HPV, the cause, effects, and how to get rid of it. HPV is the human papillomavirus. It can affect men and women. There is now a vaccine, the HPV vaccine, that's recommended for young kids. As before, it started off being recommended for adolescents, and then only those that were sexually active. But young kids can get it now, and it's recommended that they do. And it's good for even adults that haven't got it, that may find that they are susceptible. If you're not in a long-term monogamous relationship, then and you're dating people or whatever, you can get HPV. HPV is a virus. It is sexually transmitted. In most cases, it is self-limited. During my earlier practice days, when I did a pap smear on a woman, and it came back positive for HPV, we used to get aggressive and do what was called a cervical conization. And so you either took a scalpel and cut out the inside of the cervix and let it grow back, or even went down to burning it or using a laser on it to cut it out and remove the virus. Well, what we found out was you didn't have to do that because your body's own immune system, in most cases, will remove the HPV in as little as 3 months, sometimes as long as 6 months, but will basically take care of it the vast majority of the time. In rare cases, it does not, and the HPV is directly linked to a person having cervical cancer, which is why you get a pap smear to determine whether you have cancer of the female parts or not. So that is one of the reasons, that is the only reason that you get a pap smear. And that's one of the reasons why you want to monitor. So what we do now is you just get a pap smear and then you'll repeat it in 3 months. And hopefully it will be gone. If it's not, you maybe give it another 3 months. If after 6 months you're still testing positive for HPV, then you need to intervene. And so at that point, that's when you would have one of the surgical procedures. You burn it, you use the laser on it, you can freeze it, you can cut it out. All of those procedures are very important because they protect you from later getting a cancer in your female organs. That HPV can infect the cervix, it can infect the ovaries, it can infect any of the female organs down there. So you can do that or later face the possibility of having a hysterectomy to treat disease down there. But most of the time, it is literally self-limiting, and we're not as excited about it as we used to be. I know it used to be an immediate referral to GYN for surgical intervention. And when they first started changing the therapy, I sent one of my patients to an OB, and she sent me a note back and said, "Why are you sending this patient to me?" And I said, "Because they tested positive for HPV." And they said, "Well, we don't do anything about that. We just watch, and you can do that." So that's how it is now. So it is not something that you have to get excited or concerned about, other than you don't want to share it with your sexual partners. So while testing positive for HPV, you want to use condoms to make sure that is the only effective way to prevent you from giving it to a male partner. However, the male partner probably gave it to you. And so if you with that same partner, that person needs to be tested and checked. Traditionally, there has been no way for men to do that. One of the manifestations of HPV are warts on around the penis or the sex organs of a man or a woman. And so that you can take the wart, you can evaluate it, test it for HPV. But if you don't actually have warts, there's literally no way to determine whether a man has it, except for now. Now there's a new test, a urine genetic pathogen testing, where you just take a urine specimen and check for a variety of different disease states, most of which can be transmitted sexually, but instead of just a swab that checks you for the big 2 or 3. Blood tests can determine HIV status. Blood tests can determine syphilis status. Swabs can detect chlamydia and gonorrhea, but other diseases that can be sexually transmitted aren't traditionally tested for. And people will come back and say, "I'm still having symptoms." And we say, "Oh, well, you tested negative for gonorrhea. You don't have chlamydia." And then trichomonas. Trichomonas, it can be easily tested for in a woman, but there was no trick test for a man until this technology was developed. So now I can take a urine specimen and determine whether a man has trichomonas. Prior to that, a woman would go get a pap smear or a pelvic exam. She would be diagnosed with trichomonas, and they would go tell your partner you tested positive for trichomonas, that they need to be treated. And sometimes they would tell them, and the partner wouldn't do anything. So they give it right back to you again. It was just battling back and forth. So now there is a way to determine that in a male partner, and so they can be tested, diagnosed, and treated if they need to be treated. If they have warts, that pretty much answers the question down there. So that is not a mold. A mold will have a smooth surface. A wart looks like cauliflower. So if it has what's called a verrucal, VERRUCAL appearance, then that is a wart, and a wart is usually associated with HPV viral infections. Great question, Larson. You might get the question of the day, girl. TW, what test do we ask first to thoroughly check liver and kidney functions? Thoroughly checking is just a simple matter of doing a blood test called a comprehensive metabolic panel. There is a thing called a BMP, a basic metabolic panel, and you can do that plus liver function tests. But what Dr. Collier does is a comprehensive metabolic panel. And if I'm concerned about anything else going on in the abdomen, I will also add an amylase and a lipase, which are key indicators of pancreatic function. Now, if those are negative or positive and show something else you need to look for, then you can do ultrasounds, you can do CT scans, you can do MRIs, but you don't need to do all of those things. I would start off first with the blood test, and if I have any abnormal there, then that would lead me down the path of possibly doing other diagnostic scanning. People come to my office and they immediately want a CT scan or an MRI scan. And I explain to them that an MRI and a CT scan are both just basically pictures of what the problem is. So if there is a problem and you're taking a picture of it, guess what? You're going to go in, you're going to have a problem, you're going to take a picture of it, and you're still going to have that problem because it doesn't answer the question It just leads you to the possibility of pathology, which will lead to other diagnostic testing, more than likely the blood test that you should have gotten in the first place. So there's an order of things. And I oftentimes tell people, I don't order tests that are not going to change how I'm going to treat, how I'm going to diagnose you or treat you for that matter. And so don't waste your time, don't waste your money, more importantly, because those scans now cost thousands of dollars. And even if your portion is, if it's a $5,000 test, your portion is 20%. Guess what? You just spent $1,000 that you didn't have to spend. And even if you did get some pathology, you haven't fixed the problem. Now you got to go back and do everything you should have done, but you're still out of pocket $1,000 or more. Sometimes they make you pay more than 20%. So it depends on where you are. If you got one of these high deductible insurance plans with a $10,000 deductible, which are becoming very popular now because they are less expensive. But what that really means is you don't have insurance, because they don't pay first dollar until you have paid $10,000 out of pocket. That means doctor's visits, that means prescriptions, that means any medical service, they don't pay. The only way you can win is be hospitalized, where the first day you'll owe over $10,000 and then your insurance will kick in. So that is the reality of the healthcare system at this point. And that's what you need to do to thoroughly check your liver and kidney function. Great question, TW. Deborah Mathis, how do you ask a new love interest about his sexual health? What to ask? Deborah, that is probably the most adult question that you can ask. And one, I wouldn't ask it on the first date. One, I'd get to a level of intimacy with that person that I have decided that I am going to have sexual intercourse with this person, or that I'm going to be sexual, or we're going to have sexual behavior. Remember, it doesn't have to be intercourse. It can just be, hands in various places. It can be oral, or it can be full-fledged, intercourse. So the thing is, before you get to that point, even before you let somebody put their hands on you or in you, or that you're putting your hands on someone or in someone, you need to have that discussion. I have been tested. I don't have any sexual diseases, or I do have tested positive for trichomonas. I did have and have been diagnosed with herpes. And so these are chronic disease states. And of course, if you were HIV positive, you definitely want to share that before being intimate with the person. I don't think it's necessary to tell a person, when I was in college, I had gonorrhea, or I had chlamydia, because that was then, it was treated as gone. You don't have to review every partner that you had in your entire sexual history. That's inappropriate. But what I oftentimes have new couples do is bring both persons into my office and do full sexual screenings on both of them. And so that way, it doesn't matter what a person tells you, you have evidence of them being free of disease. Or if they test positive for something, then you have to, I can give you precautions as to what you can do so that you don't share that disease state. Since at this point, 1 out of 3 people test positive for the herpes virus, doesn't mean you can't have sex, doesn't mean you can't do anything. It is just the chickenpox virus manifesting itself as either a cold sore on your lip or a cold sore in your genital area. When that cold sore is not there, you're free to have sexual intercourse or to be sexual. So those are things that you have to share with a person. HIV, of course, medications these days stop a person. It's like not having HIV. They have undetectable viral loads, and that means they cannot share the disease state. So that is the full spectrum. It can be something as less invasive or as minimal as a herpes infection, something major as an HIV infection, and all things in between. And a person's sexual disease status is only as good as the last time they had intercourse. So if you're dating someone, it's highly unusual to find someone who is not dating anybody and hasn't been dating anybody. They may have a maintenance man or a maintenance woman. That means they have a friend that they're having sex with. It's uncommitted. They just for the benefits of having sex. Friends with benefits, if you will. So particularly in men, you can find this, women are less likely, but not unlikely. They are less likely to have a sexual surrogate, so to speak, that is providing their sexual needs. So again, if you're dating a person, but you still got your maintenance man or your maintenance woman on the side, then you get tested today, but you have sex with the maintenance person, then you could still be diseased or catch something. So it's very important that you go through a period of celibacy, you get tested, you decide that you're in a monogamous relationship. Until you have decided that you're in a monogamous relationship, you need to have and follow safe sex practices. That means dental dams for oral sex. That means condoms for either a male or female condom, to protect yourself from spreading and catching sexual disease states. So that is a very good question that is very mature, but it is amazing enough. It's a conversation that people find hard to have, or they don't want to bring it up, and sometimes until afterwards. You have sex with a new partner, and then 3 days later you itching or something unusual is going on. Sometimes it's just the guilties because you didn't have that conversation. And I say, oh, there's nothing wrong with you. You're fine. Other times you actually did catch something because you didn't ask. And if you didn't ask, they didn't tell you. Or they say, well, I didn't know, and they did know. But regardless, it's difficult for a person to be untruthful when you put the cold question to them. But ideally, if you both come to the doctor, and it's one of the things that a family physician will do, they can check both of you, or you can just go anonymously to the health department and tell them you want full STD testing, and they can test you. And then you get your results, they get their results, and we celebrate by going out and doing all those things that grown people can do. All right, great question, Deborah. Jules from Oklahoma. What is a good supplement for hair, nails, and skin? Thank you, Dr. Collier. Well, one, hair, nails, and skins are all products of collagen, and one of the good supplements, again, they are collagen supplements, but Dr. Collier highly recommends his vitamin D product, which is at 5,000 international units per day. Vitamin D is God's gift to the healthy body. It does so many good things. It decreases inflammation. It helps you build strong bones, strong teeth, and build an infrastructure for collagen-supported things like hair, nails, and skin. And then omega-3 fish oil, which again decreases inflammation, but also provides a good infrastructure for you to grow good hair, nails, and skin. When your vitamin D level, which is a normal level of 30 to 90, when your vitamin D level is less than 30, you have weak bones, you have weak and poor dental health, so your teeth are not strong. You have a poor quality skin, you have poor quality hair health. When that number gets 40 or greater, you have strong bones, you have strong teeth, you have healthy skin, you have healthy hair, and your immune system is boosted so that you're not susceptible to infectious pathogens, those being viruses like the coronavirus, the flu virus, the RSV virus, bacterial infections like strep throat, bronchitis, and pneumonia, fungal infections like fingernail and toenail fungus, vaginal yeast for women, jock itch for men, foot fungus for both. So all those things are benefits of vitamin D. So those are products that are readily available on the Lipo Drops website. You can go and look for Doctor's D at 5,000 units per day, omega-3 fish oil, 1,480 milligrams, one capsule twice daily, and some of our other products. We have new products that will benefit you and things that to obtain your optimal health status. Dr. Collier's triple threat, the three things that I recommend that everybody takes, the only thing we haven't talked about are probiotics. If you take vitamin D, omega-3 fish oil, and probiotics on a daily basis, you will have healthy infrastructure in your body. You will have healthy hair. You will have healthy nails. You will have healthy skin. Great question, Jules. We appreciate you from Oklahoma. All right, out in the West. Lolita. Good evening. Are the lipo pills the same as lipo drops? Do they have the same effect? The lipo drops are, no, they do not have the same effect. The lipo night pills or capsules, actually, again, they are fat. They contain fat burners and they contain melatonin, fat burners, which help you burn and metabolize fat at night while you sleep. And then the melatonin, which helps you get a higher quality and a better grade of sleep, so that your production, again, of cortisol is minimal, and you're not going to have a cortisol-induced stress responses, which increases your blood pressure, wakes you up so you're not getting quality sleep, and increases belly fat. It increases body fat in general, but it seems to focus on the belly. You've all seen those commercials where they're talking about cortisol and the cortisol response. So that is the benefit of the Lipo Night capsules. The Lipo Drops are a liquid version that was created because in the weight loss medical world, when you hear the term medical weight loss, one of the things that you receive is an injection of a medication that's affectionately referred to as LipoVite. LipoVite contains amino acids and B12 vitamins that allow you, one, it turns your weight loss mechanism on, because weight loss is an abnormal condition. Your body does not like to lose weight. Your body does not want to lose weight. It fights you the entire time. So taking those injections, the lipobite injections, would, one, turn on your weight loss mechanism. So it would tell your body it's okay to lose the weight. Two, it would change the way your body metabolizes fat. So you would not only not store fat as fuel, you would lose fat that you had stored. So that combination of things, very effective, very efficient in accomplishing that objective. The problem was, one, it is an injection. Two, you'd have to come back to the weight loss center to get it. So the lipo drops was invented. It's the exact same combination of things, amino acids and B12. It's given under the tongue, where it is absorbed as effectively and as efficiently as obtaining an injection. It is a very efficient way of getting medications into your system. You just put it under your tongue, hold it under your tongue for 2 minutes, and it's just like getting that shot. And you have the benefit of taking it every day, so you're constantly getting the benefit of metabolizing your food in the correct way, in a better, more efficient way than you are when you take the injections. So that was what the difference in the two products are. Go to the website, lipodrops.com. It will give you a clear and concise explanation of what each product is, what it does, and how it works. And you can accomplish your weight loss objectives. Again, right now we got some good Valentine's Day specials going on, so you can save a little money doing it as well. You can go to my lipo drops. You can go to my AskDrMJ site on YouTube now, where we have hundreds of videos that can answer a variety of questions on various healthcare topics. Great question, Lolita. Linda Jackson, since starting vitamin D, my rheumatoid arthritis flares have decreased. Doctors want to reduce Taxuma dosage. Again, flares have decreased, but still happen. Should I agree to fewer infusions? That is a great response, and yes, because those infusions can do. Vitamin D is the body's natural anti-inflammatory. If you're having a positive response to it, particularly if you're taking a therapeutic dose, that therapeutic dose being either a prescription strength dose of 50,000 international units one time per week, one pill or capsule one time per week, or 5,000 international units per day. And you can go even up to 10,000 international units per day because of rheumatoid arthritis. Then you don't need as much of the infusion. The infusion causes a decrease in your body's immune response. Rheumatoid arthritis is an autoimmune disease. But because you have a poor immune response, you are more susceptible to other infectious disease states like viruses and bacteria or even fungal infections. So that is one of the compromises that you have to make to keep the rheumatoid arthritis under control. But if you're getting that great benefit from vitamin D, getting fewer infusions is a reasonable thing to do, because you can always go back to taking more of them if you see that you're starting to have more frequent flare-ups, or that your flare-ups are increasing in intensity. That is an option that you will always have, because the infusions, they are just a amazing way to treat these disease states. All of these are what are called biologic therapies now, and they are being used for everything from irritable bowel syndrome, Crohn's disease, and arthritis. As a matter of fact, their primary indication was for rheumatoid arthritis, but then people with those other autoimmune diseases started to get great benefit, and they said, wow, we can use it to treat those things as well. And so they found out that by modifying the immune system, one of the other things that I would add would be the, what am I thinking about? The omega-3 fish oil, which is good, and also a body's natural anti-inflammatory as well. So you can take both of those things that will help. In the omega-3 fish oil is amazing. It also kind of oils the joints, so it kind of makes you feel better in movement when doing so. So a great way to do it as well. So go to the website, lipodrops.com, read about the benefits of vitamin D, see about the benefits also of omega-3 fish oil. These are all things that could enhance. I tell people these are all supplements. Supplements are utilized in addition to, not instead of, a prescription medication. But in this situation, a simple, elegant addition of vitamin D to your treatment regimen is giving you great benefits. So great question, Linda. And the final question. So Holly, thank you so much. I want to tell everybody, thank you for joining us, because one, you have options, and this is an opportunity for us to provide healthcare information at absolutely no cost, and where you are allowed to ask your healthcare questions. Ask Dr. MJ is now brought live to you on Facebook, Instagram, and go to our YouTube channel, where at any time you can log in. You can also access this broadcast by going to the Lipo Drops website. There's a direct link that ties you into this broadcast, and you also can get the information that you want on the products that are available at the lipodrops.com. Remember, get in the red for Valentine's Day. Get the men's sexual enhancement and booster, the Lipo T, the ladies, the Lipo hers, and have a wonderful Valentine. And we'll see you next time. Thank you so much.